a team together. And we started working in that area. And I think we outpaced the staff a bit. And we went too fast. Staff pushed back a little bit. And we listened and we adjusted our timetable and reset and we learned from that feedback and we just took our time just a little bit more. But you know what? We accomplished our first 5-year plan there in about 4 years. And we went on to have a very impactful second 5-year plan. And we accomplished that in 3.5 years. And those plans helped a lot of people, saved a lot of lives, and was very impactful for our community. So I'm proud of the work that staff did, and we made it through that rough period. And, you know, I'll just say this. Anybody that's been a health director for 25 years, every decision you make's not going to be right. Matter of fact, somebody asked me, tell me a time when your leadership team or staff came to you and changed your mind. I said, that's happened a lot because I do believe in being inclusive and being collaborative and listening and having an open mind, But let's face it, you sit in your job every day. I don't. And so how this decision would impact you, I don't know, but you know. And if you pass that information on to leadership and management and to me as executive director, I'm going to listen. Now, can we always accommodate that? We try to, but keep in mind still, what's our mission? Our mission is to help people to protect health, improve health, and promote good health in the community. So we have to keep our eye on that. But there are things that we can do. And certainly my mind's been changed many times. I'm open. I like to operate on a consensus basis where possible. I understand in some emergencies, you got to make a decision, and I do. And I stand tall and stand by it. But there's many times that there's more than one way to get to a goal. And so we do need to listen to staff and say, yeah, you know, if I had that to do over again, I think I'd do a little different.
All right, number 7.
I'm approachable too. I'm not very scary.
Let me just make sure I don't have them.
But, you know, I think it is all about building relationships, and that's what makes it fun.
No, it's right here.
Oh, I got 7 then. Okay, so my name is Fabiola Hernandez. I use she, her, pronouns. And I'm the interim resource navigation program coordinator. And my question is, says we strive to support and hold a diverse workplace, and there are many indicators that may represent disability or lack of racial, cultural, or identity diversity. For example, once hired on public health does not currently track ongoing diversity goals to monitor if we are visibly doing the right thing by our employees to address equity issues. So the question is, from what you know about Boulder County and this public health department, can you verbalize a measurable time-bound goal for workplace equity in our department?
Okay, well, that's a good question. Well, what I know about Boulder County, I know that from looking at your mission and your vision statement and from looking at, you know, some of your printed materials that, you know, health equity is prioritized here as it should be. And diversity is prioritized, the diversity of staff, everybody should be included, all viewpoints recognized and appreciated. And also providing culturally responsive programs that would be needed as well. And then emphasis of health and wellness programs targeted to communities that are most in need as well to reduce health inequities. And so I know that Boulder County Public Health welcomes diverse applicants, welcomes a diverse workplace, and prioritizes that. And I fully agree with that because, I mean, you have to have understanding of the community that you serve. And in order to be responsive to that, you have to have a diverse staff that understands that and understands those different communities and those different populations. And so I think that's a core value of this department from everything that I can see. Promote inclusion and honor the life experiences of others is one of your core tenets. And I agree with that. You've got to have it. Gosh, we are public health. And if public health doesn't have that, who does, you know? And so I may have missed part of your question. I'm sorry.
So the question was, from what you know about Boulder County and this public health department you may lead, can you verbalize a measurable time-bound goal for workplace equity in our department?
Workplace goal, yeah. I think there again, I think a workplace goal would be to try to have a goal of making sure that all populations in the community are represented and are fairly represented. And I think you know, probably a goal of having training about DEI and awareness, and not only training, but I think another measurable goal is how do you take these principles and policies and ideas and appreciations, and how do you implement them within the department at stratified levels? You know, how do you up and down the department? How do you put that into practice in your hiring practices, in your training practices, your promotion practices? In your advancement opportunities, practices. I mean, it just has to be implemented at all levels. And it has to be actually where you put these principles into practice. And I think you can do that through your policies, through your hiring practices, and through your promotional activities, and through your activities for training and professional development.
Number 8.
I have number 8. Okay. I'm Dr. Lisbeth Mendoza, and I identify as she, hers, ella, la. I am Hispanic, Latina, Mestiza, and I am here the COVID-19 vaccine bilingual confidence and access specialist, but also cultural broker. And so I think the question that you just answered ties really good with this next question. How do you, so it's 2 parts. How do you define community? And second, what do you see as the public health department's role with priority populations in the building of community?
Well, I think there are many communities in public health. You have the broad Boulder community. And then, of course, those communities are made up of population groups and community groups as diverse as they are in Boulder County. And I think you have to look also not just communities, the communities of colors and other communities, but in the communities, but also look at the communities, the potential partners besides these groups that you want to work with. For example, maybe some non-traditional partners like business, like education, and you may already do. You probably do work with the educational system already, with faith groups, with other groups, community-based organizations and interest groups in those community-based organizations. So you really need a broad array of those. And in Oklahoma City, we didn't have, when I went there, we had no community coalition. And so part of our strategic plan said, how can you do public health without a public health coalition? And so what we did is we got the mayor and chairman of the county commissioners to serve as the co-chairs of a group called Wellness Now. And that group grew from 0 to over 300 individuals, organizations, community groups, representing a broad array of the community that was well beyond the public health community. And it really takes that to be effective, to have that collective impact. You have to reach out and have that broad representation in the community and different viewpoints. And so I think you've just got to be knowledgeable about that. And of course, I think the executive director's got to rely on staff because, you probably work with many of these communities already. So you have relationships there. How do we expand on those relationships and develop new ones? And so it's definitely public health's role to link in with those because of the fact we cannot be effective going in by ourselves. Public health alone, the health department alone, we can't get it done. There's not enough resources. There's not enough people. We need these traditional and non-traditional partnerships and community-based organizations and groups to help us deliver the public health message. And by the way, using these groups to reach populations, they'll listen to a trusted member of that community more than they will me. I can tell you. And so if they go out and work with a certain group, I'll just give you an example, the anti-vaxxers. Well, if I go talk to anti-vaxxers, they'll say, well, you're paid to be here. But if you go and you have a coalition behind you or a group behind you, and you have established trusting relationships with that community, they're going to listen to you. And they can help you deliver that message. And I think that's true of COVID too. Some groups that oppose what we did in COVID, they're going to, if you can get a group and educate a group and make a group aware of the science and what you were trying to do and be open and listening at the same time, they can go help and be your champion in delivering the messages to that community. That can be effective.
Thank you.
Okay, so I believe we have about 10 minutes left, and we have 3 questions. So if we pace correctly, we might be able to get through all of them. So next is number 9.
That one. Hi, my name is Allison. I use she, her, hers. I work in the Community Health Division, managing the Community Substance Abuse Prevention Program. So as the executive director, where do you see your role in championing and progressing social justice movements such as police brutality, anti-trans legislation, reproductive rights, and climate change?
Well, those are all public health issues. And we have to, those public health issues are based on science and on what's going on in the world around us today, what's going on in public health and the needs of the different communities. And so we're supportive of all of those. And so, again, we have to stay true to science. Science does evolve and change. The world evolves and changes. But we have to be supportive of those issues. And as I said before, social justice, I can tell you, when I was on the NACHO board, we talked about the first year I was on that board 20 years ago. We talked about social justice, what it meant, some things that you can do to impact that, and some coalitions you can put together to impact. And here again, this is the power of coalitions, because when it comes to, because what you're talking about, a lot of these issues are policy issues, right? They're policy issues, and you want the community to accept these policies. And a coalition is critical to advancing policy initiatives.
Number 10.
That's me. I'm Desiree Casarosian. I'm pronounced she, her, hers, and I am the finance manager.
Okay.
So the question I have for you today is, have you ever received feedback from a subordinate or peer when your behavior caused harm? Provide an example of how you responded.
Okay. not cause harm. Well, I would think, I just think sometimes, can't think of a specific example, but sometimes when you get so focused on agenda and moving things forward, that you don't think about the human dynamics as much as you should. And so, I mean, as I say, you can't be leading a health department 25 years without doing something that I say, I could have done that better, you know, and certainly I've had my fair share of those. But the thing is I try to learn from those things. But I think sometimes when in the past, when I've been too focused on the goals and the plans and not focused enough on the human element, I've had to get that feedback. So, you know, how's this going to impact people?
Number 11.
Hello,
Hi.
I am Janice Siglich. I use they pronouns. I'm the principal investigator for the Al Rice project, part of community health. Your question is, what is your method to bridge the requirements of government and leadership with staff centered in the community and grassroots organizations? Please provide an example of a time you have done this.
So how have we worked in public health to work with grassroots organizations?
What is your method to bridge the requirements of government and leadership with staff centered in the community and grassroots organizations?
Staff centered in the community and grassroots. Okay. Well, I mean, grassroots is where it happens in public health. I mean, that's community. And if you're going to have positive change in your community, it has to be from the bottom up. And so having the public health department work with grassroots, and as I said before, respecting the staff here and the relationships that you've already developed with these grassroots organizations is key. I mean, because you've got years and years of experience in developing these relationships, probably relationships that I wouldn't have, you know, you've probably been working on these, many of you, maybe 10 or 15 years, you know. And so I just can't come in and develop those relationships, the rich relationships that you had. So it's key, and that's where it happens at the grassroots, and supporting people that work with the grassroots organizations from a public health standpoint. And that's how we get things done in public health.
5 minutes left. Okay, so we could actually fit just, I think, 1 or 2 more questions in. So we have option 1.
Me. My name is Jordan Bullard. I'm he, him, his pronouns. I'm the Site Projects and Biorecords Program Manager. Question is, what do you see as the public health role of displaced or disproportionately impacted populations who do not typically seek out government services or supports?
Good question. Yeah, it's a good question. Well, that's something we've really focused on because many of these communities and individuals within those communities don't have a voice. And so, but here's the great equalizer to serving disproportionate underserved communities. The great equalizer is data, because data is going to tell the story. It's going to tell the story. And I hope you have it zip code by zip code. If you don't, I'm sure it could be done. But you really need to know specifically the neighborhoods and the areas that you're talking about. It'll give you a clear roadmap. I can tell you. I mean, it'll say, go up here 5 miles and turn left. And here's where the pocket of these issues are. Here's the problem. It's cardiovascular disease. It's suicide. It's mental illness, behavioral health. It's diabetes. It's asthma. You know, it's social issues revolving around social justice and inclusiveness. I mean, it will tell you, and I can tell you, I'd be willing to bet that they're within Boulder, and I've never looked at your data, so I don't know. I'd be willing to bet that they are concentrated in certain areas, in certain populations. And so that roadmap will tell you, here's the problem, here's the area. And we know in public health, here's the community interventions that we can put into place. We put these community interventions into place. We measure the data on the front end, measure the data on the back end, and we see progress or not. Give you an example. When we did our 14-year data analysis on lifespan, we also found a big divergence in cardiovascular disease. So we did some things there. We put in community health workers. We had some primary care partner in there. We did our wellness thing. We identified people that were in these communities that in barbershops, beauty shops, the Ys, the libraries, the churches. And we identified high-risk people for heart disease. We linked them to a primary care doc. We gave them free medicine. If they need a statin, if they need a blood pressure medicine, they got free medicine. We signed them up for an 8-week wellness course that we put on. We linked a community health worker with them. A community health worker linked them to housing, to transportation, to all those things about the social determinants of health. They were addressed. Guess what? And we collected data on the front end, collected data on the back end. 3 years. What happened in 3 years? Stroke rates were reduced by 14% in that 3 years in that population. You need to focus on populations and areas. You got to focus on those areas because that's where you're going to get your big increases. Now, did the public health department do all of that? No. We partnered with others in the community. So it was a collective effort. But also, we reduced cardiovascular, the folks that presented at the emergency department for heart attack-like symptoms by 7% in a 3-year period. So you can make an impact in your community. Why did we focus on cardiovascular disease? Why would you? It's the biggest killer. Why wouldn't you? It's the biggest killer in our community. So put your efforts, your first dollar goes on what's going to make your biggest difference. And your first dollar is going to be in the areas that has the most need. And many times those are going to be in communities of color. It could be different here, but you know, the data will tell you that.
Great. I think that wraps all of our questions with the time we have left. So I just want to thank you, Gary, for coming to visit and being willing to answer all these questions. We threw a lot at you. So we will transition. If people want to mingle, ask Gary a couple questions out in the reception area. I know Rita will probably snatch you up in about 5 minutes,
Yeah.
but we'll give you just a little bit of time. Staff want to chat with you.
Well, thank you. Yeah, thank you all. You've been great and you've had some really good questions. And I know that you do some great work here. Hope that I'm happy to visit with any of you and get to know you and look forward to getting to know you more in the future.
All right, thank you.